I hope we didn't catch too many of you off guard by bumping up our monthly briefing a little bit early in preparation for the holiday weekend. Mostly we wanted to be sure that you got all this good information so you had plenty of time to digest it over the holiday weekend, because we know that's what we'll all be working on. But just to let you know, we're excited to have you with us today, especially because we've got Janice Genevro on the line, and many of you know her and all the work that she and her team have been doing at AHRQ for such a long time, really working solidly in this space around practice transformation. And you know, although we work closely with AHRQ and continue to update our resources and bring everybody back to theirs, we thought that this would be a good opportunity, since we hadn't done a formal check-in with all of our partners and our members and all of you who've joined us today, to refresh those of you on what the content is and all the resources that they have to offer at AHRQ around practice transformation. For those of you who do go out there on a regular basis, they still are constantly updating that information. And for those of you who haven't been there in a long time, or maybe haven't been there at all, this is going to be a great opportunity for you to learn about all these great resources and information that you can get from AHRQ as you continue to do your work on improving primary care, and certainly Jan's going to go into much more detail about all of this. And so I'm going to give up most of the time to her, but I just wanted to give you a couple quick reminders while I've got you on the line. So again, hopefully you all got our monthly newsletter, lots of great resources and information in there. We have officially launched our registration to our annual fall conference. Of course, many of you participate in that all the time. We're going to be back in Washington, D.C. at the Grand Hyatt. We encourage you to go ahead and start putting that up on your calendar. All that information will be back in November. Lots of great resources and information that we're going to have at our conference. We've also included in the newsletter information about our award recipients. Many of you attended our first ever annual awards dinner last year, so this will be our second time doing it. I hope many of you are able to attend. I mean, of course, the awardees are absolutely outstanding. Of course, I have a personal closeness in my heart and love for Dr. Calcia, who really was one of my first mentors in medical home when I was at the American Academy of Pediatrics. We're so excited that Dr. C and his wife Kathy are going to come all the way from Hawaii to be at our ceremony. So again, and a chance to honor these great people who've been doing so much work. Krasinski, she's been at many of our conferences. I know she's done webinars for us. Many of you have heard her talk about her and her husband and all the work they've done on the joy of practice. And then, of course, Melinda Abrams from the Commonwealth Fund, who's still leading the charge on evaluation of patient-centered medical home, and certainly all the resources and information that she helps connect us to, and the contributions she makes as one of our co-chairs for our Center on Outcomes and Evaluation. So please do bookmark that on your calendar to come this November, but registration is open now. We encourage you to let your colleagues and friends know about that event that's going to be coming up. November will be here before we know it. I know we haven't even gotten into summer yet, but it goes by so fast. So, okay, I'm going to stop talking now about that. Just a reminder to those of you who have not participated in our monthly briefings, we run this like a webinar. We do not, unfortunately, allow you to come onto an audio asking questions, but you will see a question box on the software. And please, throughout the conversation and the presentation, go ahead and start typing in your questions into the question box. And when Jan's finished with her formal presentation and her slides, then we'll open it up and I will start queuing up those questions and asking those of Jan. Oftentimes we are not able to get through all the questions, so don't slow down in your asking. We'll send those to Jan, and certainly we'll try to address some of them even in between by writing in some answers when we can. But please do send in as many questions or comments as you have, and I'll try to get as many of those off to Jan during the course of this particular briefing. We will have a copy of the slides and an audio recording of the webinar up on our website within 24 hours. So if you have to drop off early, or if one of your colleagues wanted to join and they weren't able to, please do send them that link, and you can just go up on our website by the end of the day tomorrow and get a copy of those. So I'm going to now cut everything off, and I'm going to turn it over to Jan. Again, I know most of you, probably a lot of you anyway on the call, know Jan very well and all of her work at AHRQ, but she is a health scientist there. And she has been a health scientist at the Center for Evidence and Practice Improvement with AHRQ, but really leading the center's work on PCMH and is involved in many other projects related to not just primary care transformation, but healthcare transformation, and really working across the whole care team and really talking about how do we help facilitate that change in the way we really change the culture of the practice as they lead to improving the quality of care that they're providing. She earned her doctoral degree in health psychology from the University of California at San Francisco and was a postdoctoral fellow at the National Institutes of Child Health and Human Development at NIH. So Jan, I'm going to go ahead and turn it over to you.
Thanks so much, Amy. Hi, everyone. I'm really pleased to be with you today to have the opportunity to share resources developed by AHRQ to support the delivery of high-quality primary care. To briefly lay out where we'll be headed today, let me try to move this slide forward. I'd like to first acknowledge my colleagues in this work, and then I'll provide a very quick introduction to the Agency for Healthcare Research and Quality, or AHRQ. And then, as Amy mentioned, I have information for you about a wide variety of resources to support implementation, quality improvement, and research and evaluation in primary care. And lastly, I'll introduce you to additional AHRQ resources that are not specifically primary care oriented, but that I hope could be helpful to you in your work. So there's a little bit of a delay here. First of all, I would like to acknowledge the other contributors to this work. At AHRQ, David Myers, who is the Chief Medical Officer now, has been the motivating force behind much of our work to improve primary care. And I'd like to acknowledge him, our AHRQ colleagues, Bob McNellis, Cindy Brock, and Michael Harrison, and also the team at Mathematica Policy Research, which has been led by Deborah Pikus and Aaron Taylor, for their many contributions. Without them, this work would not have been possible, and also for their leadership, especially in the area of improving evidence and evaluation of the PCMH. To tell you a little bit more about the Agency for Healthcare Research and Quality, our mission is to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable. We're part of the Federal Department of Health and Human Services, and we're a health services research agency. And in addition to making sure that we're producing good evidence, we have as a significant part of our mission the aim of working with the Department of Health and Human Services and other partners to make sure that the evidence is used and understood. And that's part of why I'll be talking with you today about the resources that we have, because it's part of our really strong emphasis on making sure that the evidence gets out into practice and policy. So AHRQ's work is currently focused in these priority areas: improving healthcare quality, making healthcare safer, increasing accessibility, and improving the affordability, efficiency, and cost transparency of healthcare. And our work fits squarely under the priority of improving healthcare quality. Also, in relation to these priorities, I want to emphasize that revitalizing the nation's primary care system is understood by AHRQ to be fundamental to achieving our mission. So now I'd like to move on to the heart of the presentation today, and I'll be sharing information about resources that AHRQ has developed specifically for primary care improvement. And I'll be focusing on the PCMH Resource Center website, the Primary Care Measures website, and information for health professionals about improving primary care practice that can be found on specific pages of the general AHRQ website. I'll also briefly present information about other AHRQ resources. As I mentioned, they're not primary care specific, but I think that you might find these useful, and they have to do with our Innovations Exchange, Health IT, clinical decision support, and 2 clearinghouses that we support for quality measures and guidelines. So, waiting for the next slide here, sorry for the delay. For those of you who live in the Washington, D.C. area, this map of the metro or subway system is likely to be familiar. For those of you outside of the area, it might look like a mildly confusing display of randomly intersecting pathways. But to me, it's a pretty good depiction of the organization of the online resources I'll be discussing today. We're going to be exploring several different sources of online information that are available from AHRQ, different stations, if you will, or hubs of information to help people get to their destinations in terms of primary care implementation, quality improvement, research, and evaluation. There are multiple pathways to get to the outcomes that we're seeking, and there are also multiple pathways to get to much of the information and the resources that I'm going to be presenting. And I'm hoping that our exploration today will help you find the information that you individually are seeking as quickly and efficiently as possible, and also help you act as a guide for explorations by your colleagues and peers as they seek information that can help them in their work. So our first stop today is going to be the online PCMH Resource Center. And as Amy mentioned, many of you may have already visited the Resource Center. I hope so. This website was designed specifically to serve as a library of resources related to the patient-centered medical home, or as we called it at the time that we set up the website, the primary care medical home. And I want to mention specifically why we did that. We decided to call out the importance of the element of patient-centeredness as on an equal level with the other elements that are part of the definition. And so we decided that one way to do that was to call it the primary care medical home and highlight patient-centeredness as one aspect of it. That never caught on, but that's okay. We still are using this and use it as a way to focus on patient-centeredness. So the resources on this website are organized in two primary ways. One is by AHRQ's definition of the PCMH, and then also by the focus of the user's interest. And this is primarily in terms of evidence and evaluation or implementation. And today I'm also going to highlight the activity of quality improvement and the resources that we have available regarding that. So very quickly, as most of you know, AHRQ defines the medical home as not simply a place, but as a model of primary care that delivers care that's patient-centered, comprehensive, coordinated, accessible, and continuously improved through a systems-based approach to quality and safety. And we also believe that health IT, workforce development and reconfiguration, and payment reform are fundamental to achieving the potential of the medical home. So at this next stop, I'm going to be focusing on resources that relate specifically to implementing the PCMH, some new resources that we've developed related to quality improvement, and our resources related to evidence and evaluation. And later on, I'll turn to resources that correspond more topically to the elements of the definition. Oops. So move back. In terms of implementation, the focus of AHRQ's resources have been on practice facilitation and developing this as an evidence-based approach to helping primary care practices change structures, processes, and culture in the transformation to the PCMH model. And as you'll see on this slide, we do have a section that's specifically devoted to implementing the PCMH, and the resources here relate to practice facilitation and practice facilitators. And so many of you are probably very familiar with the concept of practice facilitation or practice coaching and may even be working as practice facilitators. But I'd like to take a second just to briefly review practice facilitation and the definition of practice facilitators. And this is a definition from Darren DeWalt and his colleagues. And they say that practice facilitators are specially trained individuals who work with primary care practices to make meaningful changes designed to improve patients' outcomes. They help physicians and improvement teams develop the skills they need to adapt clinical evidence to the specific circumstance of their practice environment. And what's been found is that the specific relational aspects of practice facilitation and the direct in-person consultation that's often provided as practice facilitation have been very effective in helping practices tackle some of the really challenging changes that are part of the transformation to the PCMH. And AHRQ has been working for several years to develop a portfolio of practice facilitation products that provide support not only for organizations interested in starting practice facilitation programs and also programs that are interested in training practice facilitators, but also resources that can be used by individual practice facilitators in their work. So the main products that we have that of interest here are our original how-to guide, developing and running a primary care practice facilitation program. And this provides support for, as I mentioned, for organizations that are interested in starting practice facilitation programs. We also have the Practice Facilitation Handbook, which is a compendium of essentials for teaching and learning the knowledge and skills for a new practice facilitator. And we're also in the process of just finishing up the development of a model practice facilitation curriculum. We're really excited about this curriculum, which is designed to provide entry-level training, and it can also be used to provide a refresher on a topic-by-topic basis for practice facilitators who are already out in the field. It has about 30 modules, and as indicated here, the curriculum is competency-based, and it includes learning objectives, as well as providing guidance to instructors regarding the delivery of the content, and also about the assessment of learning by those participating as trainees. In addition, and as I mentioned, this will be available sometime later this summer, so stay tuned. We're really excited about it. We're going to have a webinar to launch the final version, and we are looking forward to getting feedback from everybody involved in the field about its use and its usefulness. But I'd also like to mention that in addition to these program development and training resources, we have a library of case studies on our practice facilitation resource pages of the PCMH Resource Center. And these case studies provide a glimpse into successful practice facilitation programs and also exemplary practice facilitation training programs. We also have access to all of the practice facilitation webinars that we've offered over the past several years. And these are all available, as I mentioned, in the PCP resources section. And also there you will find past editions of the Primary Care Practice Facilitation newsletter, which we publish every 2 weeks. And information about how to subscribe to that newsletter is in each edition that's archived on the site, and just involves sending a quick email to practicefacilitation@mathematica-mpr.com with a request to subscribe. And that newsletter is a big part of the information that we provide to individuals who are working as practice facilitators or others who are interested in quality improvement over the long haul in primary care settings. I'd also like to introduce 2 new resources that we just completed related to quality improvement. The first, well, actually, I want to mention first that both of these products reflect extensive input from experts in the field, as well as being based on the current literature. And the first white paper, Engaging Primary Care Practices in Quality Improvement, is designed specifically to provide practice facilitators with strategies to connect with primary care practices and help them build ongoing quality improvement activities into their work. There are a couple of companion pieces to this that I think you might be interested in. One includes a tip sheet for primary care practices that highlights the benefits of practice facilitation and also the benefits of engaging in quality improvement. And there's an executive summary that captures the key points of the paper. And coming very soon, we'll be posting a quick start guide that highlights the strategies that practice facilitators can use to engage practices in quality improvement. The second paper addresses the challenges and possibilities in using health information technology to support quality improvement activities in primary care practices. As practices become more familiar with the use of health IT for clinical purposes, possibilities for using this potentially powerful tool for QI can be structured and explored. A webinar based on this paper is available also on the PCPF webinars page of the Resource Center site. And a webinar on the QI paper is being planned for later this summer with PCPCC. And so we hope that you will stay tuned for more information about that. I'd also like to highlight a paper that was published in 2012 that includes some lessons learned from work on primary care transformation. And the key messages from the paper are highlighted on the left. But I think the value of the paper is that it really provides the potential of smoothing out the transformation road a bit for practices and practice facilitators that are just starting on this journey. And it has some very interesting lessons learned from AHRQ-supported research on transforming primary care. The paper was published, as I mentioned, in 2012, and it's publicly available from the Annals of Family Medicine on their website. And the lead author on that is my colleague, Bob McNellis. So now I'd like to turn to our extensive library of resources that are designed to improve PCMH evidence and evaluation. And as you can see, this library of resources has its own section on the PCMH Resource Center site, and it is filled with all kinds of information that can improve the quality of evidence. I'd like to highlight just a couple here to get you started, and I also want to highlight the practical nature and value of these resources, both for researchers and evaluators who are just beginning, and also for those who have been doing this work for a long time. For newer evaluators and researchers, one particularly useful resource is the Guide to Real-World Evaluations of Primary Care Interventions, which you'll see highlighted on the left there. This guide presents practical steps for designing an evaluation, and it's intended for evaluators affiliated with delivery systems, employers, practice-based research networks, and local or regional insurers, and others who want to test an intervention, a PCMH intervention, in a relatively small number of primary care practices, and who also might have limited resources to evaluate their intervention. And there's a lot of practical advice in there about how to go about that. For researchers and evaluators who are looking for methods that are appropriate for studying the types of complex interventions that are usually associated with the transformation to the PCMH, we offer a series of briefs and webinars to expand the methods toolbox, and that's highlighted on the right. This series highlights novel and underused methods that can be used to better assess and refine PCMH models, and also to meet the evidence needs of stakeholders a bit more effectively. Each brief in this series introduces a method or approach, discusses ways in which PCMH researchers have used it or could use it, and provides resources to learn more about the method. Topics include both evolutionary ways to improve evaluations by using traditional health services research methods, and also revolutionary approaches that draw on novel methods from other fields such as anthropology, organizational analysis, engineering, and political science. And both quantitative and qualitative approaches are included in this series. The accompanying webinars that address 4 of the topics expand awareness of these methods and encourage their appropriate use in evaluating healthcare innovations such as the PCMH. There are other resources that are available on the site. Some of them are a little bit more technical, and these include papers that examine the sample and sample sizes that studies of the PCMH need, and also information for decision makers about why and how to commission effective evaluations of medical home demonstrations. So I encourage those of you who are interested in evidence and evaluation to check out those resources. In addition, I encourage all of you to play around a bit with this last resource on the PCMH Resource Center that I'm going to mention, which is the Citations collection. And this searchable database includes more than 1,900 citations of journal articles, reports, policy briefs, and newsletters from January 2009 through last month. And it's searchable by keyword, reference, or article type, special population tag, and topic tag. And as you can see, I know that it's a little bit small, but there are subject areas that you can search by that include just about everything related to topically to the PCMH, and the Citations collection is something that I think that implementers, quality improvers, and researchers would all find of value. Okay, so now I'm going to move quickly on to our next our next information hub, and I'd like to introduce the Primary Care Measures website, and this is a brand new website that we've developed, and it's designed to help researchers identify appropriate measures for studying 4 key areas of primary care practice and transformation. And these are care coordination, clinical community relationships, team-based care, and the integration of behavioral health and primary care. And for each of these areas, different teams of researchers have developed what we call atlases. They're really compendia of measures that are available in document form from the website, but we've also developed 4 searchable databases that can be used by researchers and evaluators to really dig in and explore all existing psychometrically sound measures that we were able to identify related to these areas. Each of these 4 databases includes a conceptual model that defines elements of the service or approach. So if you go to the Care Coordination Measures database, you'll find a conceptual model for the delivery of care-coordinated services, and also an operationalization of that conceptual model so that all of the measures that we identified could be tagged back to the conceptual model to help folks understand which items and which measures are getting at specific aspects of the conceptual model. And that's also available in the database for the clinical community relationships area for team-based care and for the integration of behavioral health and primary care. For some of the areas, it was not possible to identify many psychometrically sound measures at all, and that's providing guidance for some research and measure development activities. So I want to point out that the databases are all searchable by multiple characteristics, which include the respondent. For example, there are patient surveys, but there are also surveys that could be completed by a clinician or surveys that could be completed by a representative of a healthcare system. The measures are searchable by setting in which the measure has been used, and a variety of other characteristics. The search results can be saved and downloaded, and to the extent possible, based on the availability of the measures and copyright permission, we've included either examples of the profiled measures or links to the measures that are included so that folks who are using the databases can actually see directly what the items are and how the surveys or other instruments are organized. This site also links to the PCMH CAPS site, which is a survey with which many of you are familiar, and that was also developed by AHRQ and is supported by AHRQ. So by going to the primary care measures.arq.gov site, you can also access information about the PCMH CAPS. So now, moving quickly along, I'd like to move on to the next hub and run through some of the information that's available on the main AHRQ website through our Improving Primary Care Practice pages. And I want to quickly mention, to the extent possible, I have included hyperlinks on the slides that will lead you directly to these pages, and I believe that those will be active in the PDF version of the slides that's available to you. So I hope that it will make it easy for you to find the information that you are seeking. And as I mentioned, the information on the Improving Primary Care Practice pages is organized more topically rather than by activity. And so I wanted to highlight just a couple of areas that have been the focus of a lot of AHRQ work in recent years. And the first of these is care coordination in the medical neighborhood. And on this slide, I've included a figure from a paper that was written by Erin Taylor and colleagues that I know it's really fuzzy here, not so easy to see, but I really encourage you to get this paper, which is available also on the PCMH Resource Center site under the care coordination category, to look at the model of the medical neighborhood that's provided and how information can flow to improve the coordination of care for patients in the primary care, from the primary care perspective. In this area on the website, we also provide information to support systems redesign to improve referral processes, not only between primary care and specialty care practices, but also, quite importantly, between primary care and community services. And I'd also like to mention a project that is underway to improve research and the evidence base related to care coordination. We're just starting to recruit 30 primary care practices across the country to participate in a study of a new instrument designed to assess the quality of care coordination in primary care from the perspective of adult patients. And if you know of a primary care practice that you think would be interested in participating in that measure development pilot study, please feel free to contact me. My email address will be at the end of the presentation. Okay, so moving along to another area of enhanced care delivery resources that's quite important to the transformation to the PCMH, which is team-based care. In order to deliver accessible, coordinated, comprehensive patient-centered care, a team is required. But it's also a reconfiguration of the primary care workforce and does require some changes to culture and structure and processes that can often prove challenging to the folks who are involved. The penguins you see on that slide are part of the new model of team steps, which has been developed for primary care teams. Many of you are aware of the Team Steps training, which has been available for hospitals and other care settings for quite a while, but we've just developed a new version of this that is directly focused on primary care settings, and the training is available to help improve team communication, the formation of teams, and patient safety, but also other aspects of care in the primary care setting. And the training involves videos and a variety of other materials that have been demonstrated to be effective in helping helping the primary care workforce make the transition to a more team-based model. Also, I previously mentioned our measurement resources related to the integration of behavioral health and primary care, but I also wanted to highlight AHRQ's Academy for the Integration of Behavioral Health and Primary Care, and it offers a wealth of other resources related to implementation of this approach to care. There's information about education and workforce. There is information about research that has examined how to integrate behavioral health and primary care and what some of the outcomes are that are related to that. As I mentioned, a variety of other resources, and I really encourage you to go to the Integration Academy website. You can link there from AHRQ's web pages, but also go directly there at the link that's provided on the slide to explore resources for providing this aspect of more comprehensive and coordinated care. Another topic that AHRQ has focused on in recent years that's quite important to providing patient-centered care is self-management support. And we've developed a library of resources that address the what, why, and how of this important approach to care. And our resources include 3 videos that were developed and that highlight really the challenges and joys that have been experienced both by patients and by their provider teams as teams have transformed to a self-management approach to providing care. And I encourage you to check out those resources as well. I'd also like to highlight some other resources that are specifically focused on the important steps that are needed to engage patients and families, not only in their own care, but across the spectrum of healthcare activities, including quality improvement activities within the primary care practice and policy making and other governance activities within healthcare settings as a whole. There are 2 products that specifically relate to primary care. The first is a white paper on engaging patients and families in the medical home, and the second is a decision maker brief that highlights strategies to put patients at the center of primary care. And these are resources that describe how a model of care that truly reflects the needs, preferences, and goals of patients and families can be encouraged. Those are both available in the patient-centered care section of the PCMH Resource Center site. But I also want to highlight resources on health literacy and cultural competency that are available. The easiest way to access them is through the AHRQ site, and these include resources such as the Health Literacy Universal Precautions Toolkit and other resources to help primary care practices reduce the complexity of healthcare, increase patient understanding of health information, and enhance support for patients at all health literacy levels. One resource that we just posted on the PCMH site is a crosswalk of PCMH standards and health literacy assessment. And I think that could be quite useful to folks in helping practices start the process of determining whether and how they can make their information, the information that they provide to patients and families, more appropriate for the variations in health literacy that they encounter on a daily basis. And so now, very quickly, before we get to the questions, I want to highlight a couple of other resources that have been developed by AHRQ that I think that you might find useful. And again, these are not specifically primary care related, but they do have applicability to the transformation to the patient-centered medical home and could be useful to you in other ways. The first is AHRQ's Innovations Exchange, which is a searchable compendium of best practices and exciting innovations across the healthcare universe. And there are two specific resources within the much larger Innovations Exchange that I would like to highlight. The first is a section of the exchange that focuses on building relationships between clinical practices and the community to improve care. And this does specifically focus on how relationships can be developed between primary care practices and community services to improve preventive services, but also to improve other types of care. And this is an area in which interest is growing, but there's not a particularly large or extensive database, or evidence base relating to this. And one of the resources that you will find here is an agenda for some research that could help advance the field. The other thing that I'd like to recommend is an award-winning series of 3 videos on Vermont's Blueprint for Health program, which introduces a statewide public-private initiative that seeks to provide incentives and infrastructure to support the delivery of coordinated high-quality health services that actually optimally and maximally utilizes private practice and primary care practice relationships with community services to improve patients' health quality and the quality of their lives. The next thing I'd like to highlight is AHRQ's Health Information Technology website. Health information technology is a part of our daily lives, but it can also be pretty daunting at times to figure out how to make it work for you. There are a tremendous number of resources that are accessible through this site that address human systems design factors. There are many, many research reports that relate to primary care here, and a variety of research across the spectrum that could be helpful in thinking about how to best integrate health IT into the care that you would like to provide for your patients. Moving along, I also want to highlight some clinical decision support tools that are available both for clinicians and patients that make preventive services recommendations available at your fingertips. The first is AHRQ's Electronic Preventive Services Selector, which is available both as an online resource and also downloadable to a mobile application. This resource makes it possible to search for recommendations from the United States Preventive Services Task Force, really with just a few clicks of buttons, and to get a list of recommended services and supporting information about those recommendations. And I'd also like to encourage the use of healthfinder.gov, which is a site that provides information for consumers. And the My Health Finder widget that you see on the screen is an adaptation of the Electronic Preventive Services Selector that can be used by consumers to find information about the preventive services that are recommended for them. And last but not least, after racing through this, I'd like to recommend some additional resources for quality improvement and evidence-based care. And these are 2 clearinghouses that are supported by AHRQ. One is the National Quality Measures Clearinghouse, and one is the National Guideline Clearinghouse. And both of these offer information in a very accessible way about quality measures that can be used in primary care and other healthcare settings, with a lot of background information and information about actually how to use them And the National Guideline Clearinghouse has information on evidence-based guidelines to improve the quality of care. So with that, I think we're going to turn now. Amy, are there any questions that people in the audience wanted to ask?
Oh, yes, Jan. We have lots of questions. So thank you so much for this great presentation and overview of all of these fantastic resources. I mean, I think people thought I was kidding when I said we needed to have this presentation happen before a 3-day weekend, because they truly are going to need all 3 days to get through all of this information. So yeah, this is really exciting. I've got lots of great questions, and I think what I'm going to do, first I want to encourage those of you who haven't already queued up your question, go ahead and start typing them in the question box as I start running through them and asking Jan, or if you have any particular comments. I can almost guarantee we're not going to get through everything. If you have some more specific questions, and Bob Phillips, I'm talking to you now. Bob Phillips, our good friend and leader here at PCPCC, who's at ABFM, is very excited, Jan, to be working with you and David on some of these primary care measures. So I'll follow up afterwards with those more specific requests.
Okay, great. Hi, Bob.
But let me start with some questions we've got back regarding the practice facilitation. So describe a little bit for our audience. We've got some questions regarding what do you mean when you say practice facilitator? Is that always someone who's external to the practice, or can that be someone within the practice or within the organization? Maybe just describe a little bit more for individuals about those different types of roles and how these resources can help.
Okay. I think, yes, mostly when we are talking about practice facilitation and practice facilitators, we're talking about someone coming from outside the practice to help them take a new look at how they can engage in quality improvement activities and transform, and it's a little bit like a coach of a team who comes from the outside with maybe a fresh perspective and some different ideas and a capacity maybe to see the whole picture. That can be hard sometimes, not always, but hard sometimes when you're involved in the day-to-day work of providing clinical care within a practice. One resource that I didn't mention is that we also have a short paper that's available that talks about the difference between a practice facilitator and a care coordinator or a care manager, which are two roles that often kind of get integrated together in one person because they were two new roles that a lot of practices were undertaking. And that might be helpful for folks in thinking about what the different roles are that people take on when they're doing the work of a practice facilitator. I think it is possible for people to do this on the inside, so to speak, but one way that we've thought about it is that a practice facilitator is actually providing, in a way, self-management support to a practice, or it's kind of an analogous activity. And so for people who are trying to change their health behaviors, it's often helpful to have someone to check in with who is not involved in their daily life and who can offer suggestions and perhaps is not emotionally engaged in the same way that people in one's daily environment are. And that is an advantage that we think that external practice facilitators might have. However, having said all of that, I think that all of the resources that we have available for practice facilitators about engaging practices in quality improvement activities, about how to use health IT in different ways to promote quality improvement, about some of the modules in the curriculum are about things such as holding effective meetings. They're about helping a practice define the roles of the persons within it and how to design cross-training when you're moving to a team-based approach to care, how to deal with relationships within the practice, things like that. All of those resources could also be available to someone within a practice who is serving in the role of a coach or a practice facilitator. So I don't want to discourage people from looking at them. However, I think the primary understanding of a practice facilitator is someone coming in from an external organization to work with a practice.
That's great, Jan. I think that helps people better understand and appreciate, like you pointed out, the advantage to having someone coming in externally, but then certainly knowing that a lot of organizations are seeing the importance of having someone internally then that they can hand it off to, that this really is part of their job for ongoing quality improvement. That's also so very important.
Right, and I also, go ahead. Well, I was going to say that if I were in a primary care practice as a clinician or in any other role, I think I would also be really interested in reading a lot of the materials that are going to be in the curriculum or that are in the practice facilitation handbook, just to understand what some of the background information is about all of the things that go into culture change and transformation. And so I think there's a lot of rich information for people in any role that could be valuable to them that will be coming out in the curriculum and also that is there now in the practice facilitation handbook.
Absolutely, absolutely. So there's a question regarding maybe some similarities or differences. Do you distinguish in any of your resources different types of facilitation guidelines for individuals working with pediatric practices as opposed to those working with adult practices? And if not, do you see that there being more similarities than differences, or what is your perspective on that?
That is a really great question, and I think that there are some differences in facilitation with a with a pediatric practice in comparison to a primary care practice that is either a family practice or serves only adults. And a lot of that has to do, I think, with the engagement of parents and their involvement in the care of their children in a pediatric setting. The curriculum right now is focused primarily on practice facilitation with practices that work primarily with adults. However, we are aware of the importance of identifying and helping people respond to some of the differences between pediatric practices and adult-oriented practices, and that would be the next thing that we would address in an update to the curriculum.
Perfect. So, okay, I've got through all your materials. I've read all this. So, you know, after the holiday weekend on Tuesday, I think I'm going to be pretty up to speed on what it takes to become a practice facilitator. So. Does AHRQ offer any formal certification or recognition of people who've learned this information and have this skill set? And if not AHRQ, do you know of any organizations that are using your materials and information that could potentially lead to some kind of certification or recognition in this area?
That is also a fantastic question. And no, AHRQ as a health services research agency does not offer any kind of, we don't offer training, formal training, and we don't offer certification. And I don't believe that there are any either local or national bodies now that offer certification as a practice facilitator. There are training programs across the country that can offer certificates of completion, but I don't believe that there's any formal recognition process. So part of what I would recommend after Tuesday and after all the information has been digested is to go back and take a look at the case studies of exemplary practice facilitation training programs and to get in touch with the directors of those programs to find out the absolutely most current information about any efforts to promote certification. And I would also encourage people who are interested in this to subscribe, or if you haven't already, subscribe to the Primary Care Practice Facilitation newsletter and to submit a question via that vehicle to put it out there for open discussion and to see what others are thinking about this process right now.
That's a great idea. And certainly some organizations do offer some recognition and certification for individuals who've done some additional training and work in this area. I know NCQA does offer their own program that's geared specifically towards their medical home recognition program, but I suspect that there are other organizations, and maybe not even as they might not be calling it a practice facilitator, but they might have various components of that that could then lend themselves quite easily to becoming an expert more in this area of practicing coaching and facilitation, I would think.
Right, but I'm not aware, perhaps you are, Amy, but of any national recognition programs that are kind of that are generic.
More globally, no, I'm not. But yeah, absolutely. If anybody does know of any, please do send them in the Q&A box, and we can get them posted up on our website as well. But I'm personally not familiar with any, although this is a field that is so young. It's like really in its infancy, but there's such a huge need that it's growing really rapidly, and it's certainly an area that we're paying a lot of attention to here at PCPCC, and we know that we're going to continue to work with all of you and our many other partners and organizations who are really becoming specialists in this area to figure out what the market trends, what the market needs are, and again with our other federal partners who are doing a lot of this work as well.
Right, it is growing so fast.
Yeah, fast. So, okay, there's one naysayer in the audience who doesn't think he's going to have time this weekend because he's probably going to the beach, so he's not going to be spending the whole weekend looking on the AHRQ website. He wants to know, but more specifically, let's say you're a medical student, knowing there's this plethora of resources. If you could name the top one or two that you would recommend that they start with, what would you recommend?
Wow.
It's a hard question to pick one of your favorite children.
Yeah. That is really tough. I guess the place I would start would be with the Lessons from Primary Care Transformation article that I mentioned. That's in the Annals of Family Medicine, because that's part of a supplement to the Annals that has findings from a lot of different research programs, individual research projects related to the PCMH. And I think that's an excellent introduction to the process of transformation and the issues of transformation and the challenges of transformation. So I guess that would be number one. And those articles are publicly available if you go to the Annals of Family Medicine website and just search for Transforming Primary Care Supplement. It should be quite easy to find. I guess the other two articles or papers that I would recommend are two that I did not really highlight, but they're also in the quality and safety area of the PCMH Resource Center website, and those have to do with creating a quality improvement infrastructure for primary care and why primary care has lagged a bit behind hospitals, in particular in relation to building a quality improvement infrastructure. Talks about why it's important and what the steps are that we can do to help build quality improvement activities into primary care on a day-to-day basis. So those are things that are more related to transformation and quality improvement. From a more clinical perspective, I guess I would go to the patient engagement brief. And that's a short thing that could be read even while sitting in a beach chair, sipping a drink with an umbrella in it, and it would be easily digested over the course of the weekend.
I think that's a fantastic suggestion. Yeah. You know, because quite often, even though we've recognized the critical importance of engaging patients and families and caregivers in this whole process of practice transformation and quality improvement, it's sometimes not always the first thing that people do or that people think about bringing on as part of that core team. So I think that's a great suggestion to start with that and really better understand before even moving into the whole idea of working with a practice, why that's so critically important and some of the pieces you need to put into place to make that successful. Great suggestion. So here's a real practical one. So now that you've listed off a few of those kind of top tier, let's start here, resources, and there's so many resources on the AHRQ website. If people find a few that they think would be of particular use to practices that they're working with, are they allowed to download those materials and then post them on their website, or do they need to post the links and then send them to the AHRQ website to obtain those materials? What's the protocol on that?
Everything that we produce, because it's funded by taxpayers, is in the public domain, and so people are free to use these materials in any way that they would like to and that they can use them. If you would like, we always do encourage people who, when they're linking to us from their websites or want to use materials, you can submit a request. And that information, I'm sorry, I don't have it at my fingertips, but it is available on the AHRQ website. But there are no limitations to the use of it. Partly we like people to get in touch with us so we know where and how the information is getting out to other folks.
Sure.
But it's all in the public domain, so please take it and share it with everyone you can.
Fantastic. So we're about running out of time, and I'm going to give you a question that might be a little bit hard, but I want to also kind of couch it in a way that is going to kind of tee us up for some future conversations. So there's a question that's asking about, okay, you've got all these great resources on how to transform primary care practices and facilitate that process. What about those that want to be participants in and succeed in ACOs? And then are there shared savings models? Do you get into that part of it where you really start to talk about, okay, now you've got this transform practice, and how is this going to help me succeed in these alternative payment models?
Another excellent question. I think that's really the next frontier for us in terms of providing resources and materials. Also, the Center for Medicaid, CMMI, Center for Medicare and Medicaid Innovations, is way ahead of us in this regard, and I think that checking out their website for at least insight, if not resources, would be a good place to start. So no, we don't have resources to help with that right now, other than a firm conviction that high-quality primary care is the cornerstone of any successful ACO. And so I think there could be adaptations of our materials to the ACO environment, but we don't have anything yet that is specifically targeted to helping practices participate in those different models.
Well, I told you I save that one for last because I wanted to queue up some further conversation we're going to have. So we at PCPCC are working with Brookings right now to try to identify what are some of those key factors that make that successful, specifically on the primary care side. So where do we see success in ACOs where there really is a strong foundation of primary care, as you pointed out, Jan, and how did they achieve that? So I think this is such a new area. We don't really know what the key elements to success are yet. You know, again, we totally agree with you. We think it's got to be very foundational around that comprehensive primary care delivery side of things. But we're going to be exploring that much more in the upcoming months, and certainly by this fall we're going to have some additional resources. There's lots of work going on in this area, and I just feel terrible that we weren't even able to get into the conversation around the metrics, because this is huge, and another area that PCPCC is going to want to work not only with you and Bob Phillips, but many others, because as we know, MACRA is alive and well now, and there's going to be a lot of interest in how do we really craft the metrics and which metrics do we choose that are going to really drive some of this improvement around quality and MIPS, and the you know, PCMH is front and center in that legislation, and so we are all going to need to work together to figure out what are the right metrics by which we identify that high quality care that's going to happen in primary care. And with CMS and all of our other various partners, we really hope that PCPCC, as that convener and stakeholder in this work, can really play a central role in much of that. So everybody stay tuned on that front. Much more to come. Right. So thank you so much, Jan. This was a fantastic presentation. Thanks to all of you who joined us today. Again, we will have a copy of the presentation, both the slides separate and the audio recording of this call up on our website by tomorrow afternoon. If you have additional questions for Jan, Jan was kind enough to put her email address up on the final slide. You see it there on your screen now. So she, I'm sure, will be more than happy to take those additional questions that we weren't able to get to. But if there's more information that you'd even like to send me that we can put links up to on the PCPCC website, Jan mentioned we're going to have another webinar. It looks like it's going to be in July. It's going to delve into some more of this quality improvement in practices. But again, so much of this work is really just starting to emerge, and we're so excited to continue our work with all of you. So thanks again, everyone. Have a fantastic holiday weekend, whether you're on the AHRQ website all weekend long or at your beach sipping your Mai Tai. Have a fantastic time, and we will talk to you all again in June.
Thank you all so much.
Thanks, everyone. Bye-bye.